I'm Maria Papadapoulos. I'm a consultant ophthalmic surgeon from Moorfields Eye Hospital in London. I have specialised in glaucoma and particularly subspecialised in pediatric glaucoma. So I've been on 5 Orbis projects. This is my first flying eye hospital experience. Pediatric glaucoma is a chronic incurable disease. It's a condition of the optic nerve which is damaged by high pressure in the eye, and when that occurs in children, the eyes expand. So these children have very large eyes. Often the eyes are hazy, and that reduces the vision, but if you get their pressure down, that all can clear. Pediatric glaucoma is unlike, say, congenital cataracts, where you take out the cataract, you may put an intraocular lens in the eye, and that's the end of the story. Whereas for pediatric glaucoma, it's an incurable condition. We're operating on patients, a 3-year-old who'd already had 6 operations in each eye, and I was doing the 7th operation in an attempt to just control that pressure and stop him from going blind. And our goal is to keep them seeing for as long as possible, hopefully for their whole lifetime. It became very clear discussing cases with the local ophthalmologist that they're very frustrated by their inability to have a long-term or more a definitive cure for these patients. Obviously, glaucoma is incurable and surgery is inevitable in these children, and actually they end up having many operations in their lifetime. But they're frustrated by the fact that after a couple of operations, they are still unable to control the intraocular pressure, and having to tell the parents their child needs even another operation, and they can't assure the parents that that will work as well. And it became very clear that they needed some guidance on how to perform these operations and which ones to perform once 1 or 2 had not worked. Having experienced those frustrations myself, this was one of the reasons I agreed to become a part of the volunteer faculty of Orbis, to be able to pass on what I'd learnt and the surgical skills required to ensure that these children have a successful operation with minimal complications. It's really very obvious that when you pass on these surgical skills, or when you're teaching, giving the lectures, that you can see it written on their face how much of a difference it makes to them, these few little tips you're able to offer them, and the logic behind, the principles behind, for example, the surgery and why you do things the way you do. They get it, and they're very, very grateful, because we all want the same thing. We want to make these kids' lives better, and allowing them to see and to be as normal as possible. And that's our goal, and wherever you are in the world, that's really what we're aiming to achieve for these children with pediatric glaucoma.